So Malaria 201, this section is really building upon what you heard in Malaria 101. It moves from the causes of malaria to some of the ideas around prevention, what's happening now and what's could happen in the future. So our three panelists, Dr. Marcy Erskine is a distinguished expert in malaria prevention and control. She currently serves as the working group chair for the Alliance for Malaria Prevention. In this role, she leads efforts to strengthen insecticide-treated bednet distribution campaigns and provide national-level technical support. As a co-author of important research in ITN, durability and usage, including the studies published in Malaria Journal, she brings expert insight on the optimizing bednet coverage and understanding barriers to effective utilization. We are honored to welcome her as a speaker to share in her experience guiding large-scale ITN campaigns. Her portion of the presentation is entitled Bednets in a Resource-Constrained Future, Where to Next? Next, I'd like to introduce Pranav Shrestha, who is currently a clinical research scientist at Cephala, which utilizes new technologies to improve laboratories' ability to automate and scale. Pranav's research focuses on innovative diagnostics, technologies for blood disorders like malaria and sickle cell disease, and with hands-on experience in microneedle technologies, biomechanics, and global health diagnostics, Pranav offers a valuable perspective in advancing tools and technological solutions for malaria detection and treatment. The title of his presentation is called Octopi, AI Empowers Malaria Diagnostics. And then finally, I'd like to welcome Dr. Alex von Bierbauer. He's a physician and professor of internal medicine. Dr. van Bierbauer serves as the head of Department of Clinicum Gütersloh and teaches at Philipps University at Marburg, Germany. With specialization in infectious diseases, he brings clinical and academic expertise to the fight against malaria. A member of the Rotary Foundation, Dr. Bierbauer is currently the technical coordinator for disease prevention and treatment. He currently leads a major Rotarian-led project in Kenya, supported by the German government. The title of Dr. Bierbauer's presentation is Successful Transfer of Lessons Learned, Always Adapt. So with that, let me turn it over to Marcy first.
Morning, everybody, and thanks for having me. I could be the first technology mess of the day, so let's see. To talk about where we're going in the future, I think it's really important that we all understand where we are and where we've been and how we got to where we are. So this is my first technology mess. We're going to see if this will play. And I don't really know how to do that. And it should have sound. Do we have sound? So it'll be a quiet one if they can't get the sound on. But there's no talk over anyway. The messages are clear. So I don't know if the sound people can work that out. Are you unable to get the sound on? We actually put some really nice funky music for you, so apologies for that. And just to say, while this is playing, since there is no sound, these are all pictures we collected last year to mark 20 years since the first national ITN campaign in Togo. So this was really an anniversary to mark both 20 years of national campaigns, as well as 3 billion mosquito nets that have been delivered to sub-Saharan Africa and other countries with malaria throughout the world. and I hope some of you will recognize your own countries. Anyway, our music would have rivaled Shakira on the break. So we're almost finished. So just again, to just acknowledge the number of programs and partners that contributed to that, and thanks for getting the music on at the end. So moving on, in terms of where we're going to talk about today, if I can get that to switch. Yeah. These slides are going to be quite full of data, but I'm just going to give you the key messages from these, so don't get bogged down. I showed them to my brother yesterday. He was like, but I just want to know about this. I was like, but it's just a key message. So basically here I'm trying to just point out, we have really successfully scaled up on vector control with ITNs. And if you look at the blip in the numbers that kind of comes, around 2009, 2010, after that WHO policy shift, where we went from under fives to universal coverage, you really see this massive scale up. And as you can see at the end of Q1, we're at just about 3.3 billion mosquito nets that have been transitioned out. And the image on the right is just to preempt the question, do people actually use nets? The most common reason people don't use a net is because they don't have one. So on the right, that graph, that map is showing you how many people use when they do have. So in this case, you can see the red and the yellow are really where we have problems of people have nets, but aren't using them. For the most part, when people have nets, they do use. And this is oh, it hasn't changed up there. Okay. Okay. There, okay. This is a slide based on public information that was put together by the Clinton Health Access Initiative. This will tie to, I think, some of the discussions you're going to have later in the day, but really looking at where we are with funding. And we are in a critical situation. What's clear is that the United States has been a very critical donor to malaria, both globally and then within the context of the Global Fund. And on the right, this is the Global Fund's 7th replenishment, the donor breakdown. So this is the grant cycle that is currently underway from 2024 to 2026. And you can see that the US is the biggest donor on that chart. It's important to recognize the US is not the only donor, but the trend is clear that humanitarian funding will decrease, and we're going to need to do something different. So where do we go from here? I think as we come into a resource-constrained environment, we really need to focus on 3 things. So impact. We've really been a lot about getting out volume, ensuring access, and doing that everywhere. So if I'm working in Zambia or I'm working in Nigeria, everybody's at risk, everybody needs nets, everybody needs them at the same rate. But in fact, our malaria burden is very, very heterogeneous. And so we need to really think about the data that will allow us to have impact with our vector control with what we have on our malaria burden. I think efficiency, so this is really, I took a kind of a standard definition, but I think the ability for us to produce the maximum output of acceptable quality in a minimum of time, and in this case, obviously other inputs being resources. And then we need to optimize, so find the best possible solution to the problem that we currently have. This is work that's been done by WHO, and I just wanted to focus again, moving forward, I think our focus has to be on data. And this is an example of the work that WHO has been leading, and again, just kind of reinforcing the importance of WHO as we go through this next phase of where do we go from here. Just looking at the different pieces of data that are being used to overlay to then on the right, this is obviously Nigeria, get to this mixed map of interventions of what's going to be most effective for you to have an impact on malaria. After you do that, you have a lovely map of all of the things you should do, and then you have an envelope of resources. So your next step is you have to prioritize within that envelope on what will work. So we have this issue that over the last number of years, I think you know nets are supposed to last 3 years, 20 washes. This has been very, very inconsistent, and nets do not last as we think they should. And so the graph on the left is really showing you after you receive a net, how quickly those nets leave households. So whether that's, I got holes in my net, I couldn't repair them, you know, my net went to a boarding school with my kids, so it's no longer in my house. So different reasons that nets leave households, but they do leave quite quickly over that period. And on the right, you can't see the detail, you'll get the slides later, but those are actually countries. And you can see the variation from the 3 years or over 3 years, that line across is the 3-year line. You'll see some countries we have nets lasting more than 3, but the vast majority of countries are not lasting the 3 years. And that obviously has a problem when we're trying to achieve impact. I'm putting this in to just show you, you know, there are lots of different ways we can distribute nets, and this is kind of a history of most malaria programs in the room. Most of them doing routine distribution, so antenatal care and expanded program for immunization. Many doing sort of targeted or district campaigns early days. We've also done some stratified and targeted campaigns. Then we did the under 5 campaigns integrated. Rotary was heavily involved in a lot of that work at the very start of integrating immunization and malaria. After which WHO changed their policy based on that success so that we could go to universal coverage. We are doing schools and community-based distribution. I think, again, Rotary is heavily involved on the community side. We do have these obviously huge-scale campaigns to achieve universal coverage, which we've started. And then a lot of countries with experience in social marketing. So we have options. We just don't maybe have lots of money. And then as we think about those options, I think it's really important to recognize the heterogeneity in which national malaria programs are trying to take decisions. Each of these photos is in the same country. This is Sierra Leone. I don't know if anybody is here from Sierra Leone, but you can see there's a lot of heterogeneity here. The same thing is not going to work everywhere here. What works in Freetown isn't going to work in Bo necessarily, isn't going to work in Kenema. So I think we have to really recognize this as we think about really optimizing and achieving impact. Drake Zimmerman's favorite topic, so just, you know, digitalization, some huge opportunities here around how do we get better data to achieve that impact? How do we understand if what we're doing is going to achieve that impact? So we've seen a rapid rise in digitalization in countries to collect data, a lot of it around household registration, ITN distribution, including now individual net tracking down to households using QR codes, supervision and monitoring, training, moving now with a resource-constrained environment more to e-training and virtual learning, where that's possible, obviously, and then moving payments over for a lot more accountability. There is a serious need for integration of the data that we're collecting. We, I think, still have very fragmented digital systems at the country level, and that is a weakness for all of us as we come into a resource-constrained environment. just highlighting the use of geospatial tools. The map on the left from a province in the Democratic Republic of Congo, a hand-drawn map for microplanning. The map on the right, the actual geospatial map with the real boundaries. So seeing how much variability we have on perceived boundaries versus actual boundaries, and the amount of duplication we can get in terms of service delivery because of that. And then looking at Zambia, just those geospatial maps being used to target where would you do indoor residual spraying and where would you do ITNs based on some criteria that the program had set. I'm going to skip. So this is an important one as you're thinking about the role of CHWs and community structures. What we will see moving forward in a resource-constrained environment is that communication and social and behavior change communication will be at high risk. It's going to be very difficult to pay for commodities and operations. Within operations, there are things you have to pay for, like transport. If you don't have a net, you can't distribute it. So therefore, you're going to have to get those nets there. Other things are going to be seen as nice to have. But in fact, we're in a really unprecedented situation right now. We have scaled up super effectively. How we go back is a different discussion because we're taking things away now. It's always easier to give people things, but as we start to take away and say, actually, we know you still have malaria, but we're only giving nets here because we just don't have enough for you. That explanation, that community advocacy, that building of trust that what we're doing is okay, is going to take an effort at the community level to make sure that these things actually, we continue to have uptake and use. So with all of the changes, what we're really focusing on now is as we look at, let's think about cutting this, we're trying to think about, can we mitigate the risks that that will create? And at some point, there's going to come a point we can't mitigate those risks, and then we need to take bigger decisions on the changes that we'll have to make. But as we move forward, we have to really watch some of these big changes that are happening, and particularly in relation to the security of the people who work at the last mile. If you're walking around carrying nets in a neighborhood that's not receiving them, you can actually be quite at high risk in terms of the security and the safety of the person, in addition to the commodities. So for now, I think I would say that the priority for all of us has got to be on sustained reduction of malaria cases. And that's going to require a bit of changes to take us outside our comfort zone. And that's okay, because change is important, though not always easy. We have become heavily, heavily reliant on ITNs. Within an insecticide resistance management framework, we're totally off track, and I think it's important to recognize that. But if we're going to continue to rely on nets, then I think we have to make sure that the right nets are available to people, so that they can sustain their access and use to have that impact on malaria. And that's going to require doing things differently than we are now. So this is the slide I closed with at the AMP meeting this year. So really, as we are here, just a reminder to improvise, adapt, and overcome. Like, let's not change our vision. I think we all want to still achieve exactly what the previous speaker had said, and it's a hard act to follow, by the way. But we really want to achieve that elimination eradication target. So yes, we're in a stormy time. It's going to be a bit turbulent for the next little bit. We know our way around turbulent waters, so let's just keep our focus on the vision. So thank you.